Hello everybody, I hope you're having a great day wherever you are. Coming on today to give y'all health medical updates for me and my mother. We both went for a free hearing test at a local hearing center. It was in Tucker. They have a location in Atlanta as well. It's called NUEAR Hearing Center. I'll post the link in the description box below if you're interested, if you live in the metro Atlanta area and would like to check them out. We learned about this center from our NTO group, Never Too Old group, that we get together with monthly. And they give information out to the elderly, the senior citizens, which that group is for. And so we learned about the free hearing test. So we signed up for it. We're like, yeah, we need to have our ears checked. So, long story short, I have hearing loss in my left ear. I only have 75% of my hearing. I have 25% hearing loss. And I was recommended a hearing aid because that amount of loss, it can affect your health. It can affect a number of different things. It can affect your cognitive ability because of the brain connecting with the hearing. He explained it in detail. You could do your research on it, but it made sense. I do have imbalance issues, dizzy issues, which he said, for sure, having some hearing loss could cause that. I have other issues as well, fibromyalgia and heart failure and different things, spine issues that would contribute to that. So I probably have multiple factors contributing to dizziness and imbalance, but that certainly doesn't help. However, he said I have really good insurance and they would pay $500 towards the hearing aid, but my balance would be $2,500. What? I had no idea the hearing aids were that expensive. Needless to say, yet I'm going to say it, I left there without a hearing aid. There's just no way, no way that I could do that, at least not now. I mean, the Lord will provide. If He wishes that I have a hearing aid, if I really need one, He'll provide. But I can still hear. It's not like I'm totally deaf. I mean, I'll be okay. But when I'm able, when the Lord provides, I'll get a hearing aid. My mother's hearing was pretty good. She had some loss, nothing that needs to be addressed for another 1 to 3 years. And then she would probably need one at that point. My right ear was good, but it's just my left. Okay, next subject. My MRI test results. Okay, I've got, let me get my little cheat sheets. These are my test results. And this morning I just had a teledoc appointment with my new neurosurgeon. My thoracic spine, for any of you that don't know, just a quick summary, I've had 2 spinal surgeries. I had a calcified thoracic herniated disc and had the initial surgery October of 21. The second surgery, because I still had severe stenosis, December of 22. I'm still having issues. I'm having new symptoms of feeling like bees are stinging me, bugs crawling all over me. Pretty much my whole body except for like my head. I mean, my neck, all the way down to my feet, hands, everything. So, and pain. I've had increased pain. I feel pretty much like I did before my first surgery. Not quite as bad, but it's really close. With new symptoms, with a bee stinging and stuff. And it can be really bad. I mean, it really hurts. So I made an appointment to see my neurosurgeon that did the surgeries, and he ordered the thoracic and cervical spine MRIs. He went to a different practice that is not in contract with my insurance. So that's why I have a new neurosurgeon who reviewed all of my information and basically said that there's not really anything else they can do. He said he would not advise any more surgeries, which is fine, because honestly, like I told my mother, I can't do any more spinal surgeries. It was just too rough. This last one, it's like I just can't do any more spinal surgeries, which he said, no, you can't have any more spinal surgeries. He said, we've done all that we can. He says, if we were to try to go in and do something else, the risk is too great of you becoming paralyzed. If they tried to get any more of that bone, that calcified bone that's really close, yeah, the risk is just too great for me to become paralyzed. Whoopsie. Sorry. Odds are, and I didn't think to ask him, odds are, if I'm alive long enough, I imagine this stenosis will continue to get worse and I may end up paralyzed anyway. But it's not like going to be tomorrow or next year or anything, I don't think. But anyway, so that was interesting. Yeah, I've got that bulge from that herniated disc. It basically was a failed surgery. They did everything they could, and it still is just poking out so far that they can't do anything more. There's also mild edema, swelling in that area because of all the herniations. I also have Schmortel's node formation, which it's herniations within the vertebrae that either goes up or down, not out of the vertebrae, but up or down. So that's causing some problems. But yeah, there's not anything that can be done, basically. I have been referred to a pain center because now it's just all, I have to just manage the pain because there's nothing else that they can do surgically, which is fine, as long I just need to be able to function in my normal daily activities. I mean, I cooked yesterday and I was in pain yesterday. I do my laundry. I mean, I can do so little at a time, and I'm hurting the whole time I'm doing it. I hurt even at rest. I mean, I'm just in a significant amount of pain. So I don't like taking pain medicine. I don't know what they're going to recommend. If they're going to do injections, probably not. I don't know. But I definitely need pain management, and so that's where we're at. He's put in a referral for that, and they'll be calling me to make an appointment. The cervical spine, the spine is fine. They said no evidence of large disc herniation or central stenosis. And I asked him, I said, well, since they said there's no large disc herniation, is there any at all? And he said, nothing really, just nothing. I don't want to say I didn't like him. He was too nonchalant. I'm sure he's an awesome doctor, but I just got too, and maybe he seemed very relaxed and nice, but I got just too much nonchalantness from him. Like it just, no, nothing to be concerned about, kind of thing. It's like, oh, your cervical thing is fine. It's like, okay, but they said this. Does that mean this? So basically, there probably is just some little small herniations, but within the normal range. Nothing that would really cause pain. But there is some, but it's not an issue at the moment. I just don't like dismissing something and not giving me the whole full picture. You know what I'm saying? I want to be informed completely and fully. I want to know the whole story. Give me all the details. Okay. They also, the radiologist saw there is a heterogeneous signal seen within the right lobe of the thyroid. So somewhere on the right side, the right thyroid. It says this is of uncertain etiology and evaluation with an ultrasound is recommended. I don't know what that means exactly. I did some research. I have a new primary care doctor because my former one moved to a different practice. And again, I just want to stay at the place where I'm at in Emory, Decatur. So I have an appointment with the new primary care doctor on August 10th. So I just sent her an email, a message through the patient portal, asking if she would go ahead, and put in an order for this ultrasound, because she's the one that I would need to be consulting with about this problem, whatever it is. I looked up online heterogeneous signal in the right lobe of the thyroid and what that means. It could mean a number of different things, but it primarily could be, it's an abnormal gland is what it is, and it's a sign potentially of autoimmune disease, possibly Hashimoto's disease or Graves' disease. It doesn't mean that I have that, but that's just a possibility. I do know that my ANA, the antibodies test that I had that helped to diagnose that I have fibromyalgia, was really high, and it may be because of whatever this thyroid thing is. I already have an autoimmune disease or condition, whatever you want to call it. Urticaria. I have chronic autoimmune urticaria, so I have to take a Zyrtec every day. If I don't, I break out practically head to toe, throat swells up and stuff, of hives. So I already have an autoimmune situation going on, so it could be that. And there's also the slight possibility, and I'm not borrowing trouble, I guess, depending on what the ultrasound shows, I guess there's a potential that it could be cancer. I don't necessarily think that's what it is, but that's the point of the ultrasound, and hopefully my primary care doctor will go ahead and put that order in so I can maybe have it done, get the results, and be able to discuss it with her, whatever it is, on August 10th. Okay, enough about me. Now on to my mama. She has to have gallbladder surgery, and it's scheduled for July 27th. This will be her very first surgery ever in her whole life. She is 76 years old. Needless to say, she is really, really worried and nervous about it. She gets worked up and concerned, and understandably, some people have the white coat syndrome, where their blood pressure raises, they get really just hyped up going to the doctor or dentist or anything like that. So she knows she needs the surgery. It's scheduled. She's going to have it done, but she's having some problems, dealing with it. So I would like to ask all of you to lift her up in prayer. Her name is Diane, if you don't know. She has her pre-op Monday, what's the date? The 24th, which is also my sister's birthday. And so she's got her pre-op, and she'll have a bunch of questions to ask the anesthesiologist and stuff. But just lift her up in prayer and remember her, and I will do some filming on the 27th of her surgery, taking her, and anything that she'll let me film, I'll film the process of her surgery and recovery and whatever, and keep y'all posted on that. So, and if y'all could just continue to lift me up in prayer, I would appreciate it. I'm trying my best to keep a positive attitude and to stay focused on the Lord. He is my source of strength. But you grow weary, and we have so many things going on. I've got this hearing loss. I have 2 cracked teeth. This one, I think, is starting to bother me because I have pain like in my jawline a little bit. Not too bad, and in my ear. But I want to wait till I'm not sure that it's this or the thyroid thing, because I looked up thyroid cancer, what symptoms of that, and yeah, there can be pain in your jawline and up into your ear. So I'm like, okay, is probably the tooth. You know, the whole medical thing, when you have multiple issues, it's a process of elimination. It really is, and you learn patience. You have to be patient. You can't get an answer yesterday or today when you have so many things going on. You just have to learn to be patient. One day at a time, one doctor at a time, eliminating what the things are. So this doesn't hurt me so bad that I have to go have a tooth pulled like tomorrow or anything. But I'm aware that I'm having some pain. And I'm not sure it's radiating from the tooth. It's like it is kind of like in my neck. So anyway, we'll get an answer to that soon, hopefully. And, okay, dental and glasses. I'm way overdue in getting my eyes checked and getting some new glasses. There's just so many things going on. So many needs and so little money. But nothing urgent. I have amazing insurance through healthcare.gov. I will say that if you're low income, if you have limited income, healthcare.gov, they have some amazing health plans. I have Oscar insurance through them, and they are so awesome. They are a blessing, such a blessing. They are so wonderful at paying. And if any of y'all want details, I'll be happy to send it to you as to what the insurance is, and it's based on what your income is as to what you pay. But anyway, all right, I guess that's it. We just need your prayers. We thank you for your continued support by watching my videos, by commenting, by liking. And if you have not already done so, if you're new to this channel, please subscribe. Please do subscribe so that you can, and hit the little notification bell so that you can be notified of every video that I put out so that you won't miss anything. And thanks again so much for watching. Love you, appreciate you, and until next time, God bless.